Hi, my name is Sarah and I'm with the Physical Therapy Department at Essentia Health. I'm here today to show you how to do your preoperative exercises and explain some tips to make them easier for home. I'd like you to do these exercises twice a day, once in the morning and once in the afternoon. I would like you to do these before surgery because it will make you stronger and make your recovery process after surgery easier and faster. So what's going to happen next is I'm going to walk through each of your exercises, give an example of how to do them, and some tips to make them easier. Exercise 1 is called the ankle pumps. To do this exercise, what you need to do is to sit down in a recliner chair or to lay down on a bed with your legs straight. Then point your toes towards you and then point your toes away. You'll be moving your ankles back and forth like this. This is important because it increases blood flow by pushing the blood from your legs back to your heart. This is good for you to do after surgery because it will increase the healing process and prevent blood clots. Do this 20 times. Hello. Exercise 2 is called a quad set. The quad sets will strengthen your thighs. These muscles are important for controlling your hips and knees. To do this exercise, what you're going to do is push your knees down into the surface below them. This is going to cause your heels to slightly rise, and you should feel the muscles in your thighs working. Hold for 5 seconds at the top and lower down slowly. You will do that 20 times. So up for 5, 1, 2, 3, 4, 5, and lower. Do that 20 times. And down. Exercise 3 is called a gluteal set. I personally like to call them the butt squeezes. To do this exercise, you need to tighten your butt and hold that for 5 seconds. For example, I'm going to tighten my bottom and hold for 1, 2, 3, 4, 5, and relax. You will do this 20 times. This exercise is going to strengthen your bottom, which will give you better support when walking by keeping an upright posture, and it will give you stability when walking. If you have strong hips, your knees will also be supported. So, again, tighten your bottom and hold for 5 seconds, then relax. Exercise 4 is called hip abduction and hip adduction slides. To do this exercise, point your toes towards the ceiling, like that. Maintain that position and move your legs out as far as you can go and in towards each other. It's as if you're making a snow angel. This exercise strengthens the muscles on the inside and the outside of your thighs. It gives supports to your hip and knees when walking. Do this exercise 10 times slowly. Exercise 5 is called a heel slide. To do this exercise, you will need a belt from home. Take your belt and place it around the arch of your foot. Hold the belt on each side. Keeping your heel touching the surface, slide your heel up towards you. This is going to cause your knee and hip to bend and slide it back out. This should be a slow and continuous motion. It may cause discomfort. That is okay. But do not push through discomfort and push into pain. The goal of this exercise is to decrease stiffness in your joints and increase blood flow, which will allow for healing to occur faster. Do this motion slowly 10 times. Exercise 6 is called short arc quads. This exercise strengthens your thigh, which gives stability to the hip and knees. To do this exercise, you need to place something under your knee. You can use a rolled up towel, as I have right here, or a rolled up pillow, or if you drink coffee, a coffee can is about a perfect size. Place whatever you have under your knee. While maintaining contact on the rolled up towel, lift your lower leg into the air to straighten the leg out. As you can see, my leg is straight right now. Hold for 5 seconds at the top. The hold is going to strengthen your thigh. Once 5 seconds has occurred, slowly lower your leg back down to the ground. Your leg should not thump on the ground. Do this 10 times. Exercise 7 is called a straight leg raise. To do this exercise, bend your unaffected leg like this so that your foot is touching the ground and your knee is up. Your affected leg is going to be then lifted up into the air no more than 10 to 12 inches, about the size of a sheet of paper. You're going to lift your leg slowly up into the air and lower slowly. Do that 10 times. This exercise is important because it strengthens muscles throughout the entire leg, giving support to both the knees and the hip, which will help walking become easier. Exercise 8 is called the seated hamstring gastroc stretch. To do this exercise, take a belt from home and put it around your foot. It should be placed around the ball of your foot. Maintain contact with the belt on each side and pull the belt towards you. This is going to cause your toes to point towards you, and you should feel a stretch in your calf and under your knee into your hamstrings. Your leg may slightly lift off the chair, but do not purposely try to lift your leg off the ground. Hold this stretch for 20 seconds. This stretch will cause the muscles to lengthen on the back side of your knee, allowing your leg to straighten out. This is important because we want the leg to straighten out, because if it does not straighten out, you will walk with a limp. Perform the stretch 5 times, with each time holding it for 20 to 30 seconds. Exercise 9 is called seated knee flexion. To do this exercise, you need to be sitting upright in a chair with both feet touching the ground. Straighten out one leg. Slowly bring this leg back as far as you can go. When you get to the point where it cannot go any further, hold that position for 20 to 30 seconds. This will cause the muscles that cross the knee to stretch, allowing you to increase your knee bend. It is important to hold the stretch for 20 to 30 seconds because if you hold it less than that, the muscle will not stretch. It will recoil as if a rubber band. You will do this stretch 10 times, with each time holding it for 20 seconds. To get a little bit more motion for your stretch, you can lean your hips forward like I am, and that will get a little bit more motion. And you should feel the stretch crossing your knee from the thigh going a little bit down. Another way to get a little bit more motion is when you get to your end point, use your other leg that's not being stretched to help pull the ankle back slightly. This will cause a greater bend in the knee, and you'll get a little bit more of a stretch. This should feel slightly discomforting, but do not push through pain. Again, do this stretch 10 times, each time holding for 20 to 30 seconds. Exercise 10 is long arc extension. To do this exercise, you need to be sitting in a chair with your feet touching the ground. You are going to slowly lift your lower leg up so that your leg becomes straight. Once your leg is straight, hold for 5 seconds. This is going to strengthen your thigh muscles. Once 5 seconds have occurred, slowly lower your leg back down to the ground. You are going to do this exercise 10 times, each time holding at the top for 5 seconds. Exercise 11 is seated knee extension stretch. To do this exercise, take a rolled up towel or foam roll and place it under your ankle. You should feel a stretch through your calf and under your knees. This needs to be something you can tolerate for 10 minutes, that stretch. Then take an ice pack or some weight and put it over your knee. This is going to push your knee down to increase the stretch. This exercise is important because it stretches the muscles behind the knee, allowing your leg to go completely straight. If you cannot make your leg completely straight, you will walk with a limp. Thus, we're having you do this stretch. Some things you can use for weights at home would be a bag of rice or even a bag of frozen peas. Again, hold this stretch for 10 minutes. Exercise 12 is called seated arm push-ups. To do this exercise, you need a chair that has armrests. Sit at the edge of the chair so both your feet are touching the ground. Place your arms on the armrests and slowly lift your body up into the air as if you're rising from a chair. Hold at the top and lower slowly. You are going to do that 10 times. This is going to strengthen your arms to get prepared for using your arms more after surgery, because you will be using crutches or a walker for at least 2 weeks to get around. You have just finished watching your preoperative exercises. As a reminder, these exercises should be performed twice a day. This will help make your muscles stronger and help better prepare you for surgery, making your recovery process after surgery shorter and easier. I expect these exercises to cause a slight discomfort, but they should not cause pain. So with that said, do not push through your exercises into pain. After performing the exercises, I recommend icing your joint for 20 to 30 minutes. Icing will help control pain, swelling, and inflammation. Thank you for watching, and good luck with your exercises.